The reported increases in uterine natural killer cells numbers in recurrent implantation failures or recurrent miscarriages has resulted in increasing demand from women with these conditions for measurements of both peripheral blood natural killer cells as well as uterine natural killer cells counts. We have, though, needs to remember that there is a lack of consensus during this time on the methods used for measuring or reporting uterine natural killer cells numbers. Also, there is a lack of a clear definition of what it is considered as normal levels of natural killer cells, both in the uterus as well as the peripheral blood. Last but not least, uncertainty that higher levels of natural killer cells indeed there is, and these numbers cannot be predictive of any adverse pregnancy outcome. Measurements of peripheral blood natural killer cells are considerably easier to make than those of uterine natural killer cells, since they do not require any endometrial biopsy to be performed, which is an invasive procedure. However, the significance of peripheral blood NK cells measurements is still questionable. The available tests include non-invasive blood sample for peripheral blood natural killer cell measurement. Nevertheless, it remains controversial whether peripheral blood measurements reflect conditions at the placental site. A range of measurements can be requested by clinics. Frequently, the number and activity of natural killer cells are measured. However, because these tests are looking at NK cells in the blood and not the special NK cells in the uterus, they offer no useful information in relation to pregnancy outcomes. In addition, there are some direct endometrial biopsies that can be obtained. Nevertheless, again, the results still have not been standardized by the international literature.